Welcome, everybody. Thank you so much for coming. We're putting together this Bespoke TailTalks, which is this is our first, so I appreciate everybody coming. We had chosen Club Cumming to do the first because we felt like there's really no judgments, no attitude, no rules. A lot of great conversation happens here, and it's Alan Cumming's safe haven place, especially for our community. So I felt like taking this time and really getting into the tail talks of what I really want to make from a kind of gay community discussion. I find that nobody really is talking a lot about all of the issues that surround our community, and having everybody here from the social side, from the media side, from the film industry, and also from the pharma and the medical really puts a lot of people's questions that I just don't feel are really being answered correctly. All right, so thank you. I just want to do some introductions. This is Brian Moylan.
Hi.
Brian is a freelance writer covering pop culture and penis topics, right?
Yes, my favorite topic.
Also, Vulture's Real Housewives anthropologist and writes for other various publications, and that's how we met.
Yeah.
Right? Jeff Kwong is a certified adult nurse practitioner. He spent the majority of his career working in internal medicine, focusing on persons living with HIV. Jeff and I are close friends. He's also my physician. Welcome.
Wow.
Welcome.
Oh.
He's also associate professor at Columbia University, where he directs the adult gerontology nurse practitioner program and the HIV specialty. So welcome, Jeff.
Thank you.
Raph, you don't need an introduction, do you? Yes, you do.
would like one.
Absolutely. Raph is from an infectious disease physician, Dr. Landovitz, HIV clinician with both a clinical research interest in HIV prevention, particularly the use of chemoprophylaxis as part of HIV prevention, PrEP, PEP, and microbicides. He additionally studies the impact of such prevention interventions on risk behavior. So welcome.
Thanks.
All right. And then in terms of Kit Williamson.
Yes, this is Kit Williamson. He's the writer, director, star of East Siders.
How many Emmys are there?
Like six Emmy nominations.
Wow, that's pretty
You
crazy.
can watch it on Netflix now. And yeah, it's very exciting.
Yeah, so thank you everybody for coming. So we're going to this discussion really focuses around PrEP and all the the intricacies of it. So I just kind of want to open up the discussion of maybe you guys can just talk a little bit, Raph, about where PrEP came into play in our community and what are the benefits, some risks associated with it, and why are we even having this discussion?
Sure. PrEP is really creating a revolution for gay men in the United States and Western Europe, Australia. The idea is to have something that's similar to a birth control pill, but for HIV prevention. And it's actually a piece of an HIV treatment cocktail that you would use to treat someone who already has HIV, but it's not a full cocktail. So it wouldn't be enough to treat someone they were already HIV infected. And this sort of evolved out of an understanding from medical procedures, when we've known since the late 80s that during the bad old days of the HIV epidemic, when a doctor or nurse or a health provider would get stuck with a needle from someone who was HIV infected, and this was before good treatment was available, that you could take a cocktail of HIV medicines and prevent HIV infection after that. But it was time sensitive, you had to take it as quickly as possible after the exposure, and then people extrapolated that to after sexual exposures, sort of an after the fact event. And if you say, okay, the most important thing is getting these medicines that could prevent HIV in as quickly as possible after an exposure, why not have it on board before the exposure ever took place? So it was from that the idea of PrEP was born, and so people have these medicines in their system when an exposure takes place. And it's really sort of fascinating. We have these efficacy studies that showed it works really well to prevent HIV if you take this pill on a daily basis. And it was tremendously exciting. There was slow uptake at first. People didn't really believe that it worked as well as it does to prevent HIV. And it really has changed the way people think about having sex again. I think we went through a period in the community of everyone being mortally terrified of becoming HIV infected, even with the advances and improvements in HIV treatment. This has really returned people to the pleasure of having a sex life without so much the fear that I think we all went through.
Well,
Jeff, I don't know what your
That
thoughts
was
are.
a beautiful summary. Like
Well,
you said
thank
it all.
you.
No, and I really think, yes, with the addition and availability of PrEP and this other prevention tool, that it has really opened the opportunities for many individuals to enjoy sex again and to have sex without fear. Because I think many of us have grown up in an, or at least I can speak from this table, because I'll be getting to that 50 number quite soon. Just in terms of, growing up in a time where it was very scary to have sex, and you always worried, if you got a cold or a flu or something that, oh my God, is this it? And, now, speaking personally as somebody who's used PrEP, it's changed my life too. So just in terms of being able to have sex freely, I think it's been a wonderful.
but now, do you think that it takes it on the other side now, where we talk a lot about a sexual revolution?
Oh yeah,
right?
and I think that's what we're seeing is, seeing a lot more sex parties and like things like that, and people going. And I was overhearing in a bar someone describing a party that's known for an active back room. He says, "Oh, this party's great. I get gonorrhea every time I go." And it's like, and so it's like, is that where we are now? Where it's like, obviously as sexual behavior changes, there's going to be a new set of risks, and it's never going to be completely fear-free. But I agree with you. It's like, gone are the days where you cough and you're on WebMD, like looking at symptoms of AIDS, and like, oh, I got it. It finally happened. And so I think that that's a relief for people. But yeah, the pendulum has definitely swung maybe too far in the opposite direction. I don't know.
I just think the good outweighs the bad. I mean, I had my first kiss when I was 15 years old, sitting on a trash can at a gay bar in New Orleans. This 23-year-old Chilean guy is so cool. I told him I was a freshman journalism major at Columbia. I lied to his face. And I went home after that trip and convinced myself, my little 15-year-old brain, that I had contracted HIV.
Right. No, totally.
Right.
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 And I've heard that kind of story from a lot of my friends, where really innocuous, like benign sexual acts had this tinge of dread for them. Their whole childhoods, their whole upbringing.
But on the other side, when you look at the millennials and the Insta and all the YouTube and all of that, that generation never went through what we did.
No,
right?
and I think that they also don't have that like gay stigma in the same way that we did,
Right.
on top of all of the
Right, so
health elements of
Right.
it.
So is it that the use of PrEP now allows for condomless sex?
Right. Well, and I think that that's kind of what, your doctor will tell you no, or health advocates will say, oh, condoms and PrEP. But in reality, it's basically just PrEP.
Well, I think it's a really interesting question, right? Because it is a mixed message, and it really gives people confusion over whether we think PrEP works or not, right? And I think the important point to really make sure everybody sort of has in their head is it's not condoms and PrEP because we don't think PrEP works for HIV prevention. It's, you said, hey, gonorrhea.
Right.
But yes, gonorrhea, syphilis, warts, herpes, are all things that PrEP doesn't protect you against. And so it's a question of, if you want to be protected against those things, yes, still need a condom. It's not for HIV prevention. Although there have been a few reports of PrEP failing. Even when people took it religiously for HIV, people have still gotten HIV. So it is important to remember that there are things that will break through PrEP. There are resistant viruses out there. Happily, they're very rare. And it's not perfect. It is possible to have so much sex that it overwhelms PrEP. That is a thing that we've seen in at least one case report. So, too much of a good thing.
PrEP's no match.
Keep that in mind.
Keep it in mind.
I think of it a little bit like, the levees in Hurricane Katrina, right? That storm was so powerful that there is something that will overwhelm that. And there is such a thing as so much exposure to HIV that PrEP will be overwhelmed. At least that's what it seems like from this one case.
But I think it's if we look at it from a risk reduction perspective, meaning, do we say don't have sex at all, or you must have sex with condoms? I think it gives people a little bit of choice or opportunities to make healthy behaviors, even if they, because some people will would never have used condoms anyway. So this at least provides at least some
Right.
protection or an alternate form for people to use.
And there's this militancy that we all grew up with about condom use and barrier protection. You had to do it. You were a bad person if you didn't do it. You know, like this sort of like, it all kind of feeds into an atmosphere of dread and fear.
Right.
You know, because I think it's a little bit ridiculous to think of a long-term relationship of two people using condoms you
Right,
know, into their
forever.
golden years together.
Right.
You know, like,
I mean,
you
I've
got the
never
20 years
once
still
given a
use
blowjob
condoms.
with a condom, like even though like they've told us to
I
since
thought
health
that they
class.
have ones that have chocolate flavoring or something.
Let's be
Right.
honest. Do you know anyone who thinks that giving a blowjob with a condom is acceptable?
I
knew
mean,
one person
no.
in college. I knew one person in college back in the days of Manhunt, and I didn't. I wasn't on any of the apps. I was a virgin, and he was telling me like all of like his exploits, and he would use condoms with oral sex. And I remember being like, "What is happening? How are you on Manhunt? You're my slutty friend, and you're using condoms with oral sex."
Crazy.
You actually know who this is.
I mean,
I just realized that.
I wouldn't be surprised. But you know, I think that does ask the question: is now that we have this sort of protection, how is it? What have you seen any new sexual behaviors or new things as like doctors, like people reporting to you how it's changed their sex lives in one way or another?
Well, I mean, I think you always hear of obviously the disconcordant relationship, the HIV positive versus, and even though using condoms and being and or if their viral load is negligible and minimal, that the likelihood of their partner getting HIV positive is still so low. But realistically, I think it's a game changer from that perspective because it really just gives people free kind of freedom of mind. I think the nice thing is how we're practicing now is not necessarily to but judge other people's behaviors and say you must be using condoms. That shit doesn't work, right? I mean, it doesn't work. So when someone comes in, it's kind of asking how they're engaging and what can we do from a risk reduction perspective to make sure that they are minimizing as much as possible and just giving them the choices that are there, right?
Yeah. I mean, I think as a provider, at least, I provide you the options and the choices, and I allow you or whoever that's sitting in front of me the opportunity to make that decision because you can, as I say, you can lead a horse to water, but you can't make him drink. I mean, it's kind of the same thing. So.
Right.
What I find really interesting is I have the suspicion that people have hated condoms for time immemorial and they've never used them, and we as providers do a real disservice by doing finger wagging and saying you have to use a condom 100% of the time or you are XYZ. And I think what PrEP has done is it's really let people be more honest with their providers about what they have been doing all along and giving them confidence because now they feel protected and they feel like there's an explanation in their own mind for I am being proactive, I am taking ownership of my HIV status and protecting it in a way that is acceptable to me and works for me, and it doesn't have to conform to you doctors idea of what I should be doing. And I think that's really powerful because I think also there are circumstances where people don't always have the power to decide you're going to use a condom when we have sex,
Right.
or they're drunk or they're stoned or whatever, or there are other things going on in life that makes it another priority. And this gives them a way to stay protected and take charge of that without relying on anybody else's behavior.
Latex allergy.
That's exactly. Have you ever
Heard that
had-
one before? You ever heard that?
Have you ever had a really red asshole before? That's not pretty. It's not pretty.
But so now that we are having much more sex without condoms, what do we need to worry about? Like, what are the concerns that people should start having, or different ways that they should behave? If we're accepting that as sort of the new reality.
Don't fly by the seat of your pants. Bad choice of words. If you're on PrEP, you need to be in a provider's care, right? And there are regular checkups you have to make sure it's not going to fuck up your kidneys. And happily it's a rare event, but you do need to have that monitored, and you need to be tested for STDs, right? Because gonorrhea, chlamydia, syphilis, warts. I love saying that trifecta or quadrifecta.
You say it so very, very eloquently.
Have I said this once or twice? But we in the news, there's always this horror stories of, oh my God, God, you're going to get super god-awful resistant gonorrhea, and and the super bug of gonorrhea is going to take over the world and eat you and your partner and your friends and your mother.
Is it though?
It's a great question, and we don't know the answer to that question. But the things that can be done to minimize that, right, is there have been at least one case in England that was acquired in Asia, and it was not treated appropriately. So you need to be in regular testing, and you need to be treated if you have something by somebody who knows what the fuck they're doing, and you need regular follow-up, and don't cheese it with someone that you're not confident that they know how to diagnose and treat STDs. And there's this funny thing, and Jeff, I don't know if you see this, and Evan also, there are some providers out there who are convinced that if you pee in a cup, it finds gonorrhea and chlamydia everywhere. Right. And here's a news flash to everyone, right? If you pee in a cup, where does pee come from? I don't know, your penis. And so it only detects gonorrhea and chlamydia in your, wait for it, penis. So if you want to know if you have gonorrhea in your ass or in your throat, you need to have swabs in those places. And a lot of doctors don't do that. Right. And the throat is really problematic because the antibiotics don't get in there as well. It's harder to cure, and it's really often asymptomatic. So you could have it and you don't know it, and then you give somebody oral sex, and miraculously, without a condom, unless it's chocolate. And chocolate does not kill STDs. Listerine might.
Yes,
there was a recent study.
Really?
We blogged about it.
Yes.
Wow.
Fascinating. But chocolate does not. So need to test, need to swab, need to treat.
And it was 50 seconds of, I think 50 or 45 seconds of gargling of Listerine.
Okay,
yes.
And it was only Listerine because they tried like Dwayne Reed and CVS's kind.
Did not work.
It did not work. It was only Listerine.
Put it on the label.
That's exactly
I mean, right.
Here's the thing. Didn't you always suspect this? I know I did.
Yeah, totally.
Back in my Club Cumming days many years ago, I had this suspicion about this.
Well, I remember when you couldn't floss or brush your teeth.
Oh, yeah,
because you would get AIDS if you brush your teeth and sucked a dick.
Fun facts. Somebody on the set of season 3 of Eastsiders assumed that he had HIV exposure from an openly gay actor because they shared toothpaste.
Oh, really?
Yeah, the guy's
Interesting.
not
Toothpaste?
HIV positive.
Did you write
He's
that
just
into the
gay.
script or not?
No, it happened afterwards. He
Okay.
texted him
Next season.
after the
Next
show,
season.
and I was like, "You piece of shit!"
Wow, it's unbelievable.
Wow.
Google it first.
You gave me my new drag name. Gonorrhea, chlamydia, syphilis, wart.
Those are the names of my dogs,
served a
actually.
purpose
There
here.
you go.
Coming to the main stage. Gonorrhea, chlamydia, syphilis, wart.
One thing I want to, I think, really point out and highlight, which I see it all the time, and it is so like, I'm like, wow, this doesn't, people don't know this, is really like healthcare providers don't know about the importance of swabbing other places. So I tell, when I do talks around the area, I'm like, you need to do this. And people are like, the providers, they're like, oh, I didn't know that you could do that. I'm like, yes. And
there is a test that can do it.
Right. And and I think as if the people that are listening to this piece here, I mean, I think it's important. If your provider, if you're having sex and somebody's penis is in your mouth or in your ass, like, and your provider doesn't swab those, like, ask your provider, say something.
Say something.
And
right.
if they don't know how to do
tell.
it, find somebody. Exactly, find somebody
But I
that
also
does.
think that, one thing is that I always see is that people feel as if you're on PrEP, that your provider is responsible from an STD screening perspective. And I think that you have to take ownership. And I also think that if you have a high risk exposure, don't wait. If you just got tested 2 days ago, don't wait to come into the physician's office. I mean, take kind of control of and say, hey, I had this high risk exposure. I'm nervous, even though from an HIV perspective it's off the table. Are there other things that we can kind of do now to make sure that I didn't develop any other things? Because again, it's a community-based issue. And and all of a sudden you're out there in the world, you're hooking up, you're doing what you need to, and you love it. But the reality is that you're just kind of moving this, disease process along, and it's just not worth it. So I think a lot of it is, yes, it's great every 3 months getting tested because it's mandated, and it's also, it just catches things. Mm-hmm. But also take ownership of your own kind of, will of being on the drug, where now you're able to kind of take front of that. Mm-hmm.
Do you think that if we do enough adoption and everyone is being tested regularly every 3 months, that eventually it will lead to a decline in sexually transmitted diseases?
Actually, we're seeing a little bit more of an uptick, right? Because it's now being caught, right?
Right, but But you asked the $1 million question, and I love you. You're not even a plant for that question. but the CDC actually did a modeling study where they looked at that. This guy, Sam Janess, who's awesome, he did this study where he looked at what would happen to the STD epidemic in the context of decreased condom use, when people are doing that more in the context of PrEP, and what would happen to STDs with 3-month testing. Because as Evan was saying, the 3 months is only if you have no symptoms, right? You should get tested more if you have any symptoms in between that. That's just even if you got nothing, because a lot of these things don't have symptoms, so you catch that on the 3-month ones. But you're absolutely right. And it would, the incidence rates, which means the new diagnosis rates, would go down significantly if all the providers who were giving people PrEP were doing this like clockwork. So yes, it absolutely should, because you interrupt that cycle, right? Someone has it, they don't know it, they get tested, they get treated, they don't go exposing all their partners to it. So yes, and I think that's a huge benefit that people forget about, especially the people who are so anti-PrEP and go around slut-shaming people for being on PrEP. Like, well, you must be promiscuous, and so I'm not going to give you PrEP. What? Wait, excuse me? And there was some amazing medical literature out there of a lot of providers who really didn't understand PrEP saying, yes, the only person that I would be comfortable giving PrEP to are people whose partners are positive and undetectable, and because that's a stable relationship, so I would feel comfortable giving them PrEP. Well, guess what? That person doesn't need PrEP.
Right.
I had a friend who went to his doctor and wanted to get on PrEP, and his doctor left him and said, "You don't have enough sex for PrEP," which I mean was funny, but I felt a little bad.
Now, I have heard instances of people, particularly outside of New York and LA, having their healthcare providers still slut-shaming them about PrEP, telling them that they won't prescribe them PrEP, things of that nature.
One of the things, just that I always get asked questions on its efficacy in terms of if you miss a dose, or if you miss 2 doses. And so people are, constantly asking in terms of it. So maybe both of you can kind of just talk a little bit about that.
Is it like birth control pills, or if you double up, you still get pregnant?
And then also, actually, to cut into, because there was that study that spoke that if you don't take PrEP regularly, but you could take it, let's say you're going to go out tonight and you're going to have a party and engage, that you could take 4 pills the next day, 4 pills the next day, like a party dosing, right? So maybe you guys can talk a little bit about that.
Sure. So, the guidelines say to take it on a daily basis. And they've done some pharmacokinetic studies in the IPREX trial, which was one of the trials in men who have sex with men, and they found that there is a little forgiveness factor, and there have been some other studies also done looking at that sort of on-demand or sort of intermittent dosing, which also showed benefit. But, just in terms of my patients and how I counsel, I still say take it daily if you can, because sometimes it's easier to remember, right? To take things on a regular schedule if you're incorporating it every day. Although I have had patients who tell me that they don't do that they do I don't know if have you heard it's called the 2-1-1 dosing, or the 2-1-1 formula, which is based on that strategy. So, for those individuals, I just also say that according to the guidelines, this is what it says, that it should be daily dosing, but...
Okay, so I missed a dose. I'm fucking tonight. And then I finally realized in the middle of my session that I didn't take it. Should I be worried? And should I take it when I get home? Should I take it the next day? Should I double up? What should I do?
I mean, what I tell people is if it's still the same calendar day and you realize you've missed a dose, just take your dose. Doesn't matter if it's late. And then go back to your regular dosing the next day. Don't double up. That being said, if you've missed probably 4 or 5 days worth when that happens, then all bets are off. And there are these data that suggest that if you take a double dose, it does get you back on track faster. But let's be clear, double dose, not quadruple dose. There's no 4 pills at one time anywhere. So, because, at higher doses, it could have tons of side effects, could hurt the kidneys, blah, blah, blah. But this disco dosing, as people call it, this 2-on-1 dosing, it looks like it does work.
Explain the 2-on-1 to me.
Absolutely. So there was a study done where they looked at PrEP in this basically disco dosing format. So gay men, France, Canada, right? And the instruction was, you're going to have sex tonight. It's Friday night. Right. So between 2 and 24 hours before you're going to have sex, you take a double dose of the PrEP medicine, Truvada, right? And then 24 hours after that first double dose, you take 1 more pill, and then 24 hours after that, you take one more pill again. So 4 pills total, but in a 48-hour period, dosed as 2 at one time, then 1, then 1. That's why it's called 2-1-1.
Disco.
But
Right. It's like a Mary J.
Disco.
Blige song. Give me the 2-1-1.
Your drag name,
Mary-
Disco Knows.
Mary J. Blige, if you're listening, there you go. But and the thing is, though, right? If that wasn't an isolated episode of sex, right? It's the weekend, right? Then you keep going with daily dosing after that until it's been 48 hours after the last time you had sex. So that's the important thing, right? That's if it's one time, and I don't know how many times. It's just one time.
And has that been shown to be effective?
Yes, it has been. It reduced your risk by 86% in this one study. What we don't know, and so I think what Evan was sort of asking is, right, if you've been trying to take it daily, and I also recommend to all my patients to try to take it daily and to not game the system, because we don't know if you have missed 3-4 days in a row, and then you go out and you have a wild weekend, if that really is the same kind of protective. So I do say try and take it every day, and then you don't have to worry about it. But for some people, they don't want to. They're worried about side effects. I will say this 2-1-1 dosing, it didn't have a different side effect profile than the daily dosing. So that is important to remember. Some people think less pills, less side effects, but that hasn't been shown.
Okay.
But it just works better for some people, and it's something better than nothing. And the thing is, this is for bottoming, right? We really know very little about its protection for topping for gay men. And that's important to keep in mind. So all this, it's okay if you miss a dose here, there. We don't know anything about protection of the penis. So just keep that in mind.
I know. Tops beware.
Oh no!
But
Why are they looking at you?
I don't know. Thank you so much.
that's the only time that someone's assumed you're a top.
Hey.
Wow. We just went to another level here.
Well, yeah, absolutely.
But so should we worry about that?
Should we worry about it? I mean, in the studies that were done, presumably people were topping and bottoming. Mm-hmm. It's just, when you get all nerdy, geeked out, and you try and do the science, and you say, do we know when and how, and if, the drugs get into the tissue where it's exposed. We know a lot about butts, and we don't know, excuse the term, dick, about penises.
There you go.
Because, the way you would need that information is you'd have to biopsy someone's penis. Who's in for that?
No.
I've done it before, and it's not very pleasant.
Said no one.
How do they biopsy one's penis?
You give a little bit of local, and then you take a little biopsy, and then you're like, you're looking at your cock, and you're like, oh my God, there's someone's gonna take a piece of it, and then that's it, it's over.
Oh.
And the other way you can
Biopsy
do
on
it,
your arm is bad enough.
Yes, exactly.
terrible,
Can you
is they take
imagine?
little sandpaper and they
Yes, and they scrape it. Oh, it's the
Why
worst. But then it leaves a little scar, and it doesn't look.
and a
kind of
biopsy
fun.
doesn't.
No, I know. I do it on
my
the
biopsy
undersurface.
scar
So I
right
do it on the
here.
undersurface.
I have psoriasis, and this is from where I had it biopsied to find out that it was psoriasis.
Oh.
That's even worse than when they used to stick the swab down your pee hole
Oh,
for the
that
gonorrhea
pretty
test.
hurts.
Oh.
That hurts too.
Oh, I remember that from sex ed in Mississippi.
Yeah.
Because all of our sex ed was fear-based, and it was all abstinence-only education. I'm from Mississippi, like actual Mississippi.
Are there gays in Mississippi?
Not anymore, they all left.
We all get the fuck out of there. But I remember the demonstration to make us scared of being tested was that they took the giant Q-tip and said that they stick it in, they make you count to 1, 2, 3, 4, 5. And I'm sure you don't actually fucking do that.
No.
But that's
pretty
what
quick.
some dude's mom, who was apparently a registered nurse 20 years ago, said to us.
It didn't seem like it worked.
Oh, and this poor kid Winston, who I was friends with, they took us into like the cafetorium and put a giant slideshow of exploding genitalia, and Winston fainted and had to be carried out. It was terribly. Hi, Winston. Sorry for telling people that. I didn't say your last name.
Salem. It's in Salem.
I want to kind of talk a little bit about, are pharmaceuticals making a lot of fucking money off of gays? And when you look at the, benefit of PrEP, obviously from our perspective it outweighs that. But when you look at the cost structure of what it costs for someone like me or like Kid to be on PrEP per year, does it justify it? And should it even be, when you talk about from the Trump era of kind of not having trans in the military because of the cost structure, this can kind of come to the same fruition where you say it's $17,000 for one homosexual male that engages per year to be on PrEP. When you look at the cost structure of what it is for an individual to be on PrEP in the United States, it's roughly around $17,000 for the year. I've heard of Truvada in India costing $69 a year for the same exact drug. So does someone want, can you guys talk about that a little bit?
Sure, I'll give you my 2 cents
Yeah.
on it. I mean, I don't know if the pharmaceutical companies are specifically out to, gouge or really take advantage of the community. I think part of it is there is a cost that goes into developing and researching a product and sort of developing it. There are cost savings programs for people who have insurance. So many of my patients can actually get it for free if they have insurance. Or there are some co-payment assistance programs that are supported through the company or one of their foundations that provide support. So I think if people want it, there's a way to get it. For some people, it's a little bit more challenging price-wise, but for many people, at least in the community that I take care of, can get it for free.
And I think pharmaceutical companies like Capsule, which I use a lot,
Yeah,
I know
yeah,
you guys
yeah,
use
yeah.
them a lot, they have this kind of cost-saving coupon stuff. So I guess it just, people look at it and they're kind of concerned from a commercialism perspective that it's all wonderful that everybody's on it, but it's also a financial reward.
But isn't that deeper than just this conversation?
100%.
Oh,
Yeah,
absolutely.
Everything in the pharmaceutical industry, and I don't think you should have to have a social worker to navigate getting your prescriptions down from $17,000. Like, I think that that's a bigger problem where in a capitalist society, nobody is fully taking responsibility for educating people about how to pay for their health care. We're just saying, well, screw you if you don't know, screw you if you don't have an education and can't read the literature yourself to figure out how to get a copay card. That's a bigger problem. that
100%.
I don't know how to fix, but I can point it out.
And I think, is it in Australia or somewhere that they just announced that their health, like people, their citizens can get Truvada for like $5 a month or something? Did you see
I
that?
didn't.
Okay.
I didn't see that.
But I think just, it's a bigger issue. Like, it's our insurance, it's our healthcare country. I mean, it's our healthcare in this country.
We want to demonize somebody, right? Because
Right.
it's a broken system.
Right.
Right? It's broken from a pharmaceutical sort of standpoint. It's broken from a insurance standpoint. It's even
Absolutely.
broken from your healthcare provider because I have had my doctor prescribe me topical ointments for my psoriasis that were like $500 a month. I get to the counter, I freak out, I find out there's a generic I can have for like $25.
Right.
Why is that my responsibility to
Right.
know?
I completely agree with you, Kip. The system is so broken beyond repair that to demonize one thing, the pharmaceutical companies, is almost unfair, right? I mean, you're 100% right. The insurance companies are out to make a profit and don't really prioritize health access, health equity, health transparency the way they need to. And until we fix all those other things, I think it's hard to finger point. But I do think, Evan, you bring up a sort of an associated point, which is, you got a lot of people out there who are seroconverting to HIV, and they don't either know about PrEP, they don't know that it's an option, they don't trust the system, they're not health literate enough to be part of this revolution that we're all talking about and benefiting from. And it's a parallel conversation that's bigger than this, but we need to figure out how to fix that, or we're never going to end the HIV epidemic. And we're in some ways really lucky to be able to have this conversation,
Right.
because there's some people who don't even know and can't participate at the table.
Right, and I think that's why and from Bespoke Surgical, and why I kind of put this together was to really just open up the door for everybody to see that there is so many different ways from an exposure perspective. And then it kind of leads us right into the next topic, which is PrEP helping the sexual revolution and the slut enjoy sex, and not helping minority status or low income where it actually needs to be, where those are the high risk exposures, and the kid from Westchester that has anal a couple of times a year
Right.
is benefiting, and his exposure is minimal because he says he has sex all the time, but he really has it once a year, right? And so I think, again, a lot of that comes to really where is this? Is it in the right communities? And how do we all work together to get it there?
Sure. Well, you know, it shocks me because I do trainings for different healthcare centers, and in my neighborhood, which is in the heart of, you know, Gay Mecca, Chelsea, we do it all the time. I have 20 patients a day. Probably 18 of them are PrEP-related visits or PrEP information visits. I did a training in the Bronx, which is literally less than 5 miles from where I am, which is one of the highest incidence areas. And providers were like, "Oh, nobody needs PrEP here. We have one PrEP patient." I'm like, "You are kidding me."
Right.
And so yes, you know, I don't think patients. I don't know if we're getting this wonderful tool to all the populations that need it, especially communities of color, and especially, I know this is focused on men who have sex with men, but also women aren't accessing, and the trans community also probably not accessing it to the fullest extent. So.
Well, and non-openly gay people.
And non-openly gay people.
But gay people have always been early adopters.
Yeah.
Right.
And
Yeah.
so hopefully this is like a nice test pool where people will see, oh, this is working for this small section of this community, and hopefully it will go out to other communities. I just don't know how it can even possibly go out to straight women of color in Mississippi.
Right.
You know, like how, because they don't know that they're being exposed. They don't,
Right.
you
Well,
know. Like,
and whose responsibility is it? Is it ours as like the gay community to take care of those people who are at risk? Is it the pharmaceuticals company to make sure that the people that need the drug are getting it? Is it the health, you know, who should be in charge of making sure that everybody who needs it gets it?
I mean, I kind of feel like this is something that the health departments really need to take on, because, you know, it shouldn't come from pharmaceutical companies, right? Because they're going to be then demonized as being promotional for their needs, and they do have to answer to their shareholders. But I mean, it's responsibility as health professionals to get this message out, and I think we do a shitty job at that, to be honest with you, right? I mean, if you think about, you know, people that are good at marketing, I mean, you know, look at, you know, what kind of cell phone do you guys have? I mean, I know what kind I have. And I know that I have to run out and get the brand new one as soon as it's available. And they know how to make you need their product. And we as doctors and providers, you know, we do a shitty job at making someone need or want something that's going to be beneficial to their health. And we need to learn how to market this. And we don't do a good job. You know, the black women in Mississippi don't know about this. Why? Because how do they get their information? From their friends, from their church, from their, you know, social media, you know, and we need to get messages out in ways that groups use it. You know, the black gay men that are young in Los Angeles, where do they get their information from? We need to understand that and find a way to, you know, get the information there. And then whether people decide to uptake it, that's up to them, but they need to know.
So what you're saying is we need a PrEP Snapchat filter.
Yeah.
Like
Yes.
that's what, like,
You're
you know,
right.
There
That
you
should
go.
be
you
there
know,
with
like
the little
big
blue pill.
going in your mouth.
Wave, everybody
He's like, hey
wave.
girl, I'm PrEP.
Why not?
We should make one.
We
not?
should. We should.
I will say New York City has done an amazing job
They
at
have.
this.
Subway
Amazing. You find it in
ads.
the subways, you find it on billboards, and not a whole lot of other jurisdictions have been quite so sort of everywhere, and you need to be everywhere.
And you know what, say what you will about Andrew Cuomo, but I was at AIDS Walk a couple of years ago. He got on the stage and gave a speech about ending HIV in 2020 and talked about PrEP. And I'm like, this is amazing that you have an elected official talking directly to your community, about things that affect and impact your community. And New York is a special place for that.
Well, and I think what's great about the ads we're seeing on the subway now is that they're sex positive in a way that it's like, you know, this is so that you can have sex and be free and whatever, in a way that I think that condom ads and things like that weren't always before. And so I think that it's sort of embracing the sexual revolution, as you will, as a reason to help get people involved in this.
And then on the flip side, you know, I don't know if you guys see the same thing in yours, but when I talk to people and I'm interviewing and I'm saying, do you have any medical problems? They're like, no. And then you go down and you say, are you on meds? They're like, oh yeah, I take HIV meds. And then you say, well, do you not think that HIV is a medical problem? And the answer is they don't, because they're taking a pill or their friends are taking a pill. And I see it over and over and over again. And the people that are affected and should be on PrEP, the 20-year-old kid, the 22-year-old kid, doesn't actually think that HIV is a problem, because if he gets it, he just takes other pills, and it's just more of a chronic disease. Do you guys see the same thing?
Absolutely. I mean, I've had that conversation multiple times where patients, I'm like, so do you have any medical problems? No. And we go through the whole thing, and then we get to the medication piece, and then it's like, oh yeah, I take XYZ, which is a HIV medication. I'm like, oh, well, let's go back to the conversation.
Right.
So yeah, I see that too.
But I mean, it's a double-edged sword, right?
Right.
Because we don't want people who acquire HIV to feel like, oh my God, it's a death sentence. Because if you're able to take your treatment, it isn't, and it can be very simple with a pill every day. Still, you would rather not have it if there were a way to prevent it. But so I think it's the messaging, both from pharma and from us, that is making this generation who don't remember the bad old days, and that messaging combined make them not actually think that, why would I take a pill every day to prevent something that then I would just take a pill every day to treat.
Right, which I think is an interesting crossroad, right? Where you say to yourself, oh, and then, but I think again, it goes back to the risk assessment component. I talk a lot of clients with open relationships, and they don't think that they're candidates from a PrEP perspective. Right. And it's a discussion that we have all the time, which is to say, look, you have to look at yourself in the mirror, and is it open? Is it open-ish? Do you talk to your significant other about kind of all the sexual acts that are really happening? And then how do you really kind of protect yourself, right?
When ending HIV stigma is so important, but at the same time, it's not an internet-ready conversation. Like I think you were saying earlier.
It's too nuanced to talk about on the internet. It's too nuanced for a Snapchat filter.
Right, because your Snapchat filter must say, we must end HIV stigma. Right. You don't have room for an asterisk that says, but you really don't want to get HIV because here's what could happen to your life expectancy, and here's what the potential health risks of that. Like, it's not just about taking a pill, and it's hard to convey that in an advertising perspective.
But I also think on the flip side, from you look at social media and you look at people in this day and age feel as if the more followers you have, the more credibility you hold. And that becomes a really tough point, because the 20-year-old kid, the 18-year-old, the 17-year-old gay that's coming out, that's saying, I'm going to be a bottom and I'm going to love it, and I'm going to be there, is looking at all of those social stars to say, oh, this is how he does it, it has to be correct, right? And so it's kind of interesting in this day and age that the people that we're actually trying to really focus the PrEP use on, how do we, and this is why I started this, was to try and figure out how we as physicians and kind of advocates for everything can really kind of take center stage to make sure that people are actually advocating the correct way and the way that's going to be the most effective.
We had a recent example of this, right? Justin Timberlake came out on his Snapchat
as
or
a bottom,
whatever.
Oh my God, I gotta go.
Anti-vaxxer, right? He doesn't vaccinate his baby, and the internet broke. When that happened, at least from a medical perspective, right? But you need someone with that sort of star wattage to get the most at-risk people to listen. And it's probably different for different communities, right? A young black gay man, a young Latino gay man, a trans woman isn't going to necessarily relate to the same, YouTube channel as a white gay man, or in New York City, in Chelsea, right? And so I think finding the right spokespeople for these messages is hard, but it's critical if we want the message to get out. But it is nuanced, and I think it's really challenging right now, with everyone's attention span being at zero. How do you get it in a tweet or a soundbite that people can digest? Because it's more complicated than that.
Well, I think we also need to end the stigma around promiscuity. Like you said, everyone assumes that if you're on PrEP, you're being promiscuous, and that may or may not be the case. But even if you are, like, who cares?
Right. No, good for you, because I'm sure not.
Exactly. Like, I'm a self-identified slut, so I'm like happy.
You're an ethical slut.
I mean, sometimes ask all my exes, but So I don't.
And that goes on to and that goes on to the slut shaming component, and I think that we really need to kind of just hit that maybe as kind of the last segment here of really what do the heterosexuals feel on this topic? That's one, and then also kind of if I'm on PrEP, am I considered a slut? And then also that kind of the shaming component that's out there, that people are just, are they trolls, or are they really just people that are just speaking their their complete mind. I don't know. I don't know.
Truth.
What?
Yeah.
The
Their
truth.
truth. Truth.
Yeah,
It's
their
my
truth,
truth.
I guess,
Yeah.
right?
I'm a reformed slut shamer. I was raised very religious, and I had a lot of shame about being gay, so I translated that shame into shaming others. And I feel like that's the velvet rage of it all, right? Like that is what people do. They have internalized shame, and then they need to get it out there, and they put it on other people. And there's a part of me, there's a little tiny part in the back of my head, there's a tiny little voice that still has those instincts. When you said the word bottom, I was
Yeah.
like, you know, like
Right.
something in the back of my head
Like,
said,
it's
like,
wrong.
don't
It's
say
wrong.
the word bottom. How stupid is that?
Right.
But at the same time, you know, everybody is at a different place in their fucking journey, and there are some people who are gonna go to the grave in their 70s with that shame.
Yeah.
And have no idea that that's why they're being an asshole.
Right.
Yeah. Well, I think it's more of a concern when, like you said, that there are people that could be prescribing this that are saying like, no, I'm not giving it to you because
Oh yeah,
you're a slut or
fully
whatever.
fuck your own mother.
You know, it's
Yeah.
like,
Right.
I mean, I guess I just don't give a shit what anyone thinks. Like, if anyone's like, oh, you're on PrEP, you're a bottom, it's like, well, yeah, who cares? Like, whatever, okay. But yeah, but I think if it's a barrier to people getting like treatment, I think that's really bad. But otherwise, like, people just need to shut the fuck up.
But I think we see a lot of providers still.
That's what I was
who
going
do
to say.
that.
Yeah.
I mean,
100%.
I've had so many people come to see me after another provider or multiple providers have said, I'm not giving you PrEP, why can't you just zip it? And you know, that's
Right.
not helpful, right, at all. And happily, you know, there are these online
Yeah, I was going to say, it's
sites.
amazing.
You know, Damon Jacobs
Yeah.
started PrEP Facts in, I don't know, 2010, 2011, I don't even know. It's got like, you know, 30,000 followers or something like that. People, you know, crowdsource, you know, like
Right.
where can I find someone who's not going to slut shame me, who's going to give me the facts, know what they're doing and do it right. And that's really reassuring to me.
Right. No, and you know, I think the message I always give is this is something that you can do for yourself, and you're taking charge of your health. And you know, regardless of what people say, you're doing something that is positive. And I think that's a message that healthcare providers, that the community really needs to embrace. Like, people are doing this as a proactive, positive thing. Like, you don't tell people don't exercise because you know it's bad for you're doing something healthy. This is something that allows someone to be in control of their own health.
And I also think it's important to say that you don't have to be on PrEP forever.
Yeah.
Right? I mean, that's what I feel like people
Right.
feel like you go on it and then like, I'm on this and fuck, this is my life, you know?
Right,
I mean,
right.
And it's the reality is that it's just risk assessment. You know, if you're at the point where you're out there and you're hooking up and you're saying, you know, I'm trying to find that person, and then once you do, you now say, let's get HIV tested, let's get the whole gamut, and let's come off of it, right? It doesn't have to be a lifelong situation, and it could be, you know, transient in it.
Yeah.
But I think it's just setting the expectations that we want the community to take charge of their own actions, and we as providers can provide people the access and the information, and then for everybody to just kind of take the stronghold for the community.
Yeah, the conversation is so reminiscent of what women went through in the 60s with the birth
Right.
control pill, right? It's like, you're a slut if you're taking the pill, right? And you shouldn't be having sex. And, you know, God knows, you know, thank God, you know, the sexual revolution sort
It
of
is Good
got through
Friday.
that.
Yeah.
There you go.
Oh my goodness.
You didn't even know?
Cheers.
But, you know, here we are again, you know, in 2018, reliving this. It's like Groundhog Day all over again, you know, and, you know, did
But
we
the
learn
women
anything?
were minorities at that time, of which some they feel as if still there are, and now here we are, all as considered minorities in the same situation, right? And is our voice really doesn't matter?
Well, I think, you know, but we have an opportunity to fight this battle for the communities that are still, you know, having trouble saying that I'm gay because of stigma in their community, homophobia, racism, sexism, transphobia, right? But we can have the voice for them and fight this battle for them, which is one of the great things about this conversation.
Yeah.
So my question is, now that we have PrEP, or this PrEP, what's like the next frontier for PrEP? Like, where does it go from here?
So there's a bunch of things that are, you know, sort of in the pipeline, so to speak. Injectable PrEP is probably the next thing that we're going to see, and that is going to be something that's a shot in the butt.
Do I give it?
Do you personally give it to
Yes.
everyone
Can you give it to
in the
yourself?
world?
Can you give it to
Not
them?
yet. In the studies right now, it's provider administered, but the hope at some point is that it will be self-administered or partner administered or something like that. So, and it's once every 2 months at this point. And then the next thing that's coming are little implants, like things like women use for birth control that you go under the skin, and it can sit there for 6 months, a year, maybe more. We don't know yet. And if that works, that'd be really exciting also. And then lubricants and gels that are, for lack of a better word, impregnated with PrEP medications that would be anti-HIV that you could use as a lube or a douche or whatever. And that's probably a little further away, but I think the more options that somebody has, there's going to be something that's going to be acceptable to everybody. So we need options. We need them to work well. We need them that the communities who are at risk are going to want them. So there's got to be a lot of research and a lot of testing before we get there. But that's a little bit about what's coming.
2020, I think.
And so are we on PrEP until there's a vaccine, or what? Like, how long are we with PrEP?
Vaccine, we're 30 years on into the HIV epidemic at this point, and unfortunately, in my opinion, some people might disagree with me about this, but we're just as far away from a vaccine today as we were 30 years ago. So, we need PrEP or something like PrEP until there's a vaccine. The vaccine's the holy grail. It really is, right? Give me a shot or 2 shots, and then I'm immune forever for HIV, and then we end the epidemic worldwide, but we're not there.
I think let's just end on kind of oh, my mom found my pills, the little blue pills. These are vitamins I take every day. I think, it's a lot of people's conversations of how do you just have conversations, and what type of conversations should you have if you're on PrEP with your family, people. How can you be advocates for our community?
Who wants to field that one?
I don't. Well, I think it again really depends on the person and their family situation or their social situation. I think talking to many different people who are on it, it's been everybody has a different experience. So some people are like, "Hey, how are you? My name's Joe, and I'm on PrEP." Like it comes right out. And then other people, want to be more private. And I think if coming out or speaking about it causes any sort of threats to your whatever safety, then I would say don't, then kind of keep it more private. But if not, I think it's important to be kind of that advocate, that educator, talk to your friends, and you don't have to necessarily say that you're on it. You could say, hey, do you know about PrEP? Do you know about this opportunity? And have a discussion. I don't know. I mean, that's my 2 cents. I really think it's an individual situation. It really depends on the individual, because there are some people who might not necessarily feel comfortable if there's safety or there's issues in terms of family or violence or something where it might come up as a challenge. So I would say in those situations you don't have to. Other people, are in a different spot where they it's one of the first things they say, like, hi, I'm Joe, I'm on PrEP. Are you?
Right.
So I think it really depends on that person. And for some people, even if you want to talk about it with your friends and you don't necessarily want to say that you're on it, you could say, hey, my friend Rafi's on PrEP, and do you know about PrEP? Do you know how do you stay safe?
Right.
And have that conversation and just be an educator and an advocate. So I think it just depends.
And to
on the
not
situation.
necessarily out yourself if it's a situation that is uncomfortable,
Right.
And or that there's going to be ramifications that you haven't really thought out the
Right.
plan for.
Right. I think everybody has a right to privacy, a right to not have their business spread out all over the place. But at the same time, as a community, we've identified that we need to be having these conversations. It's one of the reasons why I put PrEP into the 3rd season of my show.
Right.
Because I feel like destigmatizing having these conversations is the first step towards destigmatizing all of it.
Is that your Emmy award-winning speech?
Thank you.
Is that
This is
it?
my Emmy.
Yes.
I think as long as it's in your Grindr profile, you're fine. Like that's all that needs
That's a
to know.
way to have the conversation, though. It is.
Right.
Without having to go down the rabbit hole of what it means to you as a gay slut to be on PrEP.
Right.
Right.
Just having that conversation in some form, I think, is super important with anybody who is having sex with anybody.
There it is.
And I think that the future is that there are going to be these other things that we're going to have that are going to be able to be used more privately, right? There's a shot, you don't have to carry around your pills, and for people who might not feel safe or don't want to have that conversation, there are ways that hopefully we'll be able to do that, which is really important in places like sub-Saharan Africa, where women could really be subjected to violence. Or, or I've had patients be like, my boyfriend threw it out the window because we had a fight. They don't want me taking this stuff. So I do think safety is really important. But you're right, it can be a cornerstone of these conversations. I think it really lets us have this conversation because we're talking about PrEP. And I think for relationships, it does open up this whole conversation of what makes people feel good and what they really want to do in the bedroom, and not have the shame around it. So if it can be that sort of cornerstone of a conversation, it's served a huge purpose. Forget about everything else even.
And I just want to say, thank you guys so much. I mean, I think, you guys being here, our first TailTalks, which I think really went really, really well, just really gives the community a sense as to what's going on, all the advocacy that we're all trying here, from TV to the pharma world to kind of the physician world, and hopefully moving from a press world, to really just get the word out from a positivity perspective, and to put the slut shaming, to put all of the issues aside. It's individualized. It's everybody's right to have access to this care. It's everybody's right to have be on it or not, and really to just have great conversations about all the issues that surround our community. So thank you guys for coming.
Does anybody else feel like we're on an episode of Untucked right now?
Yeah. Like
I saw the fishnets, they were ripped.
But thank you guys. No, I appreciate it so much. I think this is going to be great. And, our goal with this is really to create it and then take this into Middle America. I think that it's super important to have these conversations at a bar with people that have no concept about this, that there is homophobia. And for us to kind of stay neutral in that it doesn't always have to be all about the gays, right? But to understand where Middle America is and to understand the 20-year-old gay that's stuck in that. What access, what are their limitations, and to have both sides. Here we're all sex positive and we're all gay and we're all involved in this, but I think to make this conversation work is like a Bill Myers, is like all of those, where you're taking it into places where we don't necessarily know what's going to come out of it, but to kind of, the more we highlight it, the more that we're really able to see how much more work we actually have to do.
Are you planning on doing more of these before?
Yeah.
Or are you pitching this one?
It's probably this one, and we're going to see how this kind of tails, and then see from here where to go.
Well, if you want the hookup in Mississippi.
That's it. I get it.
I'm not kidding at all.
Yeah, no, and I think it's also the travel, the trans issue is a huge issue right now. The transitions from people that, obviously New York, we're so secluded in our world in New York and LA that this is not reality.
Well, I remember teaching, because no one would teach me about sex, teaching myself about sex through, Sex in the 90s specials on MTV, and, Real Sex on HBO.
Strips.
And,
What was not strips? What was it? Undress.
Undress.
Right.
Yeah.
Yes. But I think in the real world, when it was, the first
Yes.
HIV positive and he passed away.
Yeah.
Exactly. I mean, when you look at our world, but we're living not in a real world, we have to really see what's out there. So, I mean, my whole goal was to kind of have this initial conversation and just, see where it goes.
I can tell you firsthand how important this kind of representation is. Growing up in Mississippi, I just was so hungry for any kind of representation. Anybody speaking directly to me, I was desperate for it. I mean, Danny from the real world was my sexual
partner. Oh, my Lord.
Favorite quality in a man?
Chest hair.
Faithfulness. Forearms.
How would I like to die?
Peacefully.
Quickly.
In my sleep.
The natural gift I would like to have.
Singing.
Eternal youth.
Athleticism.
Your favorite poet.
Oh, Hart Crane.
Frank O'Hara or Elizabeth Bishop.
Your idea of earthly happiness.
Ooh.
World peace.
Boners.